You are listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello and welcome back. This is Adam Rosen, and you're listening to the Your Knee, Your Health podcast. Today I want to give you a little tip on the 4 things that I commonly recommend to people to get prepared before they travel. I'm recording this right now during the coronavirus pandemic, so I've had a lot of friends and family members and patients that had trips that have now been canceled, but at some point we will get back to traveling again. And when I talk to people that have knee pain or knee arthritis, there's a lot of fear involved with setting up a travel plan because they're not sure what's going to happen to their knee. Now, I'm not sure what's going to happen to their knee on their vacation either, but I always recommend that people bring 4 things with them. So the first thing that I recommend that you bring is a collapsible hiking pole. You can find these at many outdoor stores near you. And the nice thing about this is it is collapsible, so you can make it quite small and you can put this inside your luggage and forget about it if you don't need it. But this way, while you're on your trip or vacation, if you have knee pain, or maybe your knee's doing pretty well, but you're going to walk on some uneven surfaces and you're concerned about your knee, then you can always take this and pull it out and use it as needed. And I've talked to a lot of people. There's a lot of concern with the vanity of using a cane. They tend to feel old when they're walking around using a cane, but you just look a lot cooler and hipper walking around with a hiking pole. So definitely pick up a hiking pole and put that in the luggage. The second thing that I ask everybody to get is a Ziploc freezer bag. I try to do everything I can to eliminate the use of unnecessary plastics, but this is one time where it's good and useful to have a large Ziploc-style freezer bag. And the reason is, occasionally you will have pain. And usually if you're staying in a hotel, you can find an ice machine. The problem usually is that people can't find anything to put that ice in. They try wrapping it up in a towel. So this way, if you have a large Ziploc freezer bag, if you have pain, you can go fill it up with ice, put some barrier between the plastic bag and your skin so the ice isn't directly on your skin, and then put it on your knee. Now, the third thing, which is good to take with you, is a bottle of acetaminophen. Now, you want to avoid this, obviously, if you have liver disease, so talk to your doctor and make sure that it's okay. And this comes in 3 different strengths: the regular strength, which is 325, extra strength, which is 500s, and arthritis strength, which is 650. There's not really a best. You can use the arthritis strength as 1 pill at 650 milligrams, or if patients have the extra strength, you can always take 1, and then if needed, take a second one, up to 3 times a day. So the 4th thing that you want to take with you is an anti-inflammatory if there's no reason for you not to take it. Now, some people with significant kidney disease or bleeding issues or on a blood thinner can't use these. Some patients are on prescription anti-inflammatories, things like Celebrex or meloxicam. So you can bring that with. If you're not on a prescription anti-inflammatory, just pack a bottle of your ibuprofen, which is brand name Advil or Motrin, or naproxen, which is brand name Aleve. And this way you'll have it available if needed. When you're having pain, you have the option of using either the acetaminophen or the anti-inflammatory of your choice, or both on a bad day. And this way you're set up and you're ready for your trip should you develop any knee pain while you're there. So again, 4 things to get and pack up in your luggage prior to traveling: a collapsible hiking pole, a Ziploc freezer bag, a bottle of acetaminophen, and a bottle of your anti-inflammatory of choice. Thanks for tuning in and listening. I hope that you found this information helpful. If so, please subscribe so you'll be updated for future episodes. And if you believe that you have one friend or family member that could benefit from this information, please recommend this podcast to them. I'm Adam Rosen, and you've been listening to the Your Knee, Your Health podcast. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. it helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.